This video is designed to show how to prepare the Liquiband Fix8 device for open hernia mesh fixation and topical wound closure. Once out of the box, the device can be primed and ready to use in simple preparation steps. It comes with a removable cannula tip, revealing a secondary tip to be used for topical wound closure. During the entire preparation process, it is important to hold the device vertically, with the distal tip of the cannula pointing in a downwards direction. Rotate the purple tube clockwise until an audible cracking sound is heard. This is the sound of a glass ampule being crushed in order to release the adhesive. Wait for 5 seconds. Then slowly push the tube back into the device handle. At the final portion of travel, rotate the tube anti-clockwise to completely align the indicators and lock it into the device body. Fully rotate the purple dial clockwise until it comes to a complete stop. With the distal tip of the device within the plastic tray, pull the trigger 2 or 3 times until a drop of adhesive has been dispensed. The device is now primed and can be placed in the sterile field until the surgeon is ready to use it. This section demonstrates how to repair a direct inguinal hernia with the use of Liquiband Fix8 compatible mesh. Before making an incision, the area in and around the hernia should be cleaned and local anesthetic applied. After anesthesia, create a 5-inch length incision in the groin, above the area of the hernia. Create an opening in the tissue layers and use manual tissue retractors to open up the area for easier access. Next, dissect down through the muscle layers of the abdominal wall in order to gain access to the hernia site. The next incision should dissect through the hernia defect in the spermatic cord to reveal the hernia and/or the hernia sac, which is simply the peritoneum that lines the inside of the abdomen. Make an incision on the hernia sac and gently push the contents back into the abdomen, or dissect the contents free from the hernia sac and return them into the abdomen. The peritoneum and spermatic cord should then be closed, as well as any defect in the abdominal wall underneath. Next, place a Fix8 compatible mesh underneath the spermatic cord. This is used to reinforce the hernia defect. Fix the mesh in place against the abdominal wall using the Liquiband device. Ensure that the adhesive polymerizes before moving on to the next anchor point. A visible white color should be seen after 10 seconds. To avoid tension, create anchor points in each corner of the mesh, then proceeding to fill in between where desired. The muscle layer should be closed using a suture, whilst the skin is glued topically using the Liquiband Fix8 device. Ensure that the incision is cleaned and dried prior to closure, using a surgical gauze, and ensure that hemostasis has been achieved. Before topical closure, remove the primary cannula tip by twisting off in an anti-clockwise direction. Hold the incised skin edges together and apply adhesive over the top of the well-opposed skin. Hold for approximately 10 seconds so that the adhesive has time to polymerize. This application should be replicated across the rest of the wound until fully sealed with Liquiband glue. After topical closure has been completed, inspect the area and ensure that the device is discarded as per the hospital's recommended guidelines.